The following segment is paid for by Florida ENT.
Welcome to Healthcare Champions. I'm Shelley Sanders. Today we're talking all about the ear, nose, and throat. I can't think of a better person to talk to than Dr. Scott Powell, who's with Florida ENT and Allergy. Welcome to the show.
Thank you for having me.
We're talking ears, nose, and throat. This has got to excite you, huh?
It gets me going.
Now, here in Florida, I know you see all of it. I mean, the allergies, they keep you busy year-round, don't they?
They do. And the problem with Florida, too, the seasons don't really exist.
Yeah.
There's no freezes, so allergies go all year round, and they keep us busy.
For sure. So keeping you busy, it's a good thing that Florida ENT and Allergy, you guys have, what, 13 locations in the Bay Area?
13 locations and 25 of me around seeing patients.
Fantastic. So there's certainly a location for you out there if you need an ENT, allergy specialist, you name it. So let's get down to it and talk about some of the topics that come in, some of the patients that come in, and what are these. One in particular that comes off the top of my head is sinusitis. Talk to me a little bit about that. What exactly is it, and what do you do about it?
So the problem with sinusitis, it is a black box. People throw everything inside of it. So people come in with nasal problems and they don't know what the problem is, and they just say, my nose, it's not good. And so our job is to kind of delve through that, peel back that onion and say, what is the real problem? And a lot of times it is just the sinuses, and those are the air pockets around the nose that keep our head a little light.
Sure. How do you begin to diagnose that? And do you find that a lot of times you might have patients that come in and have been previously diagnosed with that, and then you get them in your office and you realize, wow, we got a bigger issue here.
Yeah, so the best thing is when they come in, we can do a full comprehensive evaluation. We have instruments in the office. We can look deep inside their nose to see if it truly is their sinus or just allergy. We have the ability in the office to get a CAT scan so we don't have to go somewhere else, get more answers. We can leave that office with a plan. They've come in between treated and treated, and we can find out where they need to go next.
Dr. Powell, that's huge. You just hit a very, for me personally, that's a hot button for me. I can't stand going to the doctor, but certainly when it's a situation where I think, if it's a possibility of needing an x-ray, a scan, or something else, this is just not going to be fun. It's so aggravating. So you guys do all of that in-house.
We do. People have things to do. They have lives to live. So we want to bring it all in one package when they come in. So when they come in, being treated or otherwise, we can walk out of that with a comprehensive plan, multiple steps, and then decide which path to take.
Now, what kind of tests would you get done? Is it just scans and x-rays there in the office, or what kind of things do you do there?
Great. So a lot of times we can do in the office initially is we have cameras. We can go inside the nose right then. Easy numbing and look around to see truly is it the sinus, and that can be done right there. It's very minimally invasive. It's very comfortable. I've actually done it to myself just to prove the point. But beyond that, we can do allergy testing. We can do CAT scans, look at their sinuses. If their voice is evolved, we can do further voice evaluations in the office. We really do have a very comprehensive approach.
No kidding, and all that's done in-house. That's huge. I mean, that eliminates, and I can only imagine, especially with elderly and sometimes situations on how to get around and relying on rides and maybe even public transportation, that really eliminates a lot of the anxiety and stress from a patient's perspective, I would imagine.
Exactly, and getting off of work and then time between work. So people really have things they want to do other than being in our office or in a office. So if we tell them, oh, go get a CAT scan, go get a camera scope, there's no way on earth they're going to get it all done reliably. So it relied upon us to let's package this up so we can get it all done together.
Certainly. Well, Dr. Powell, let's back up just a little bit and come back to that sinusitis. So let's say, yep, now we've definitely discovered it is in fact your sinuses, and what is that treatment plan? What do you do about it? And is it invasive? Is it something that you're going to have to live with for the rest of your life? What do you do?
So piggybacking off the in-office options, we really do have a lot more options in the office. So before, the old fear story of sinus surgery being rotor-rooter, scraping this, packing that, everyone cringes. So now what we do, we actually can, in the office, for an example, we can go in with a balloon device, go into their existing opening that's just narrowed from all the infection or allergies, and we can, with a balloon, dilate that. Wow. And now they're back to normal. Oh, no. And they're doing it wide awake. They can drive home. It's all done in about an hour, and it's over.
And they can drive home?
They can drive home.
So they're awake?
They're wide awake.
Oh, my goodness.
Talking just like we are.
Wow. Do you have patients? Is that their reaction when you tell them that this is how it's going to go down? And do you want to do this now? And they look around like, what? this is the answer to my prayers, because I know it can really be debilitating. You talked about taking off work just to see the doctor. Some cases I've seen people have such extreme cases, they're out of work because of it.
Yeah, the recovery time and so forth. You know, the big thing is patients just, they want to get it done, and they always say, I wish I knew this earlier.
Oh, gosh. Well, hopefully none of our viewers are thinking, gosh, I wish I'd done this earlier, because they're already a patient of yours. But in case they aren't, how do they get a hold of you at Florida ENT and Allergy?
Well, the best way is to visit our website, floridaentandallergy.com, and from there they can see all of our locations, all of our abilities, and then make an appointment.
The preceding segment was paid for by Florida ENT. Can't stop sneezing? Having issues with your throat? Sinus problems? Florida ENT and Allergy is here to help you. We have a great team of medical professionals and 25 physicians on staff delivering superior care, one patient at a time. We've been serving Tampa Bay residents for 40 years. From pediatric allergies to fitting hearing aids, our physicians use cutting-edge technologies to provide specialized ear, nose, and throat care for the entire family. Florida ENT and Allergy, here to help you and your family.